Good morning to all. My name is Dr. Gulwish Sadique, Assistant Professor, Department of Physiotherapy, Faculty of Paramedical Sciences. I am here to deliver a lecture on the topic itself, that is rotator cuff injury. So let's discuss what is rotator cuff injury. So before further we are going on to different topics, just like subheadings, we just need to look what is rotator cuff. What is the meaning behind the rotator cuff? As the word suggests, rotator. Rotator means something which is aiding it to rotate, which is helping it to rotate, as well as the cuff signifies something which is enclosed in a cover or a sleeves. Okay, so this means rotator cuff injury. So basically, as we all know, rotator cuff injury that has to be occurring on the shoulder joint itself. So further, this rotator cuff injury, we are going to subdivide this topic into different categories. So first of all, we are going to talk about the etiology. So what is etiology? Etiology is basically cause of the disease. What is the underlying cause of rotator cuff injury? As we all know, there is always a degeneration which is going into a muscle itself, which in turn causes the tendon to get rupture on its own. So the factors which are underlying for this rotator cuff injury is the age. So age is the factor which is causing it to get degenerated near or at its insertion into the tuberosity. Near or its insertion into the tuberosity. So what happened? This degeneration due to age is leading to rupture. Rupture of what basically? Rupture of the tendon itself. Okay? So this is how this rotator cuff injury has come into play. So this is all what is there in the etiology behind rotator cuff injury. Now the second one is mode of injury. So what is mode of injury? So if we are going to look at mode of injury states how the lesion or the injury is taking place. So how it is taking place? First of all, there are three conditions based on which this rotator cuff injury is taking place. So first of all, we have fall on the shoulder. Whenever an individual or a person falls on the shoulder, so that is type 1 condition. Second condition is whenever a patient or an individual is trying to lift a heavy object itself. Okay, so that can again leads to rotator cuff injury. Now the third point states whether the position which you are holding or the position which you are acquiring is correct or not. So for that, what is the correct acquiring position? You should always know. For athletes itself, whenever they are into habit of overhead actions, so those overhead actions can also lead to this rotator cuff injury. So one has to always keep in mind what is rotator cuff injury and how this is trying to occur. Okay, so here we have finished what is the mode of injury behind it. So there is another a condition beside this which states that how this mode of injury is occurring. So that condition states like we are talking about degeneration. For example, in a senile patient, in a senile age group, which is senile age group means that the person is in those age group which has the ability to get his shoulder joint degenerated. So for those, especially those people, what happens? The shoulder joint, we all know because of the age factor, the shoulder joint is getting degenerated. Shoulder joint means the muscle which are helping and aiding to make that shoulder joint intact is getting degenerated. We all know. So what happened in those conditions? If a minimal trauma, if a minimal trauma is given in those conditions, so what happened? There could be a chances of rupture. Ultimate rupture is the chance. Okay. So here we have completed our mode of injury. Now we are going to switch on the next topic, that is clinical features. This is one of the very most this is the basic and the foundation on which your diagnosis acts, okay? Your assessment, your evaluation, as well as your diagnosis acts. So clinical features. So what are the clinical features beside this? If a person has got trauma due to certain these three conditions, involving in these three conditions, so what are things and symptoms which you are going to see on that shoulder joint? For example, you are going to look for redness, then warmth, you're going to feel for warmth, and whatever all the acute exacerbations that you could feel in that acute conditions, you're going to feel all that. And with last and not the least, very important, that is your pain. You will feel a pain that is sharp and shooting, okay? And there will be a loss of movement, especially abduction and further flexion, okay? So now next, now we have discussed about abduction. So initially the patient, if you will tell patient to elevate your shoulder joint in abduction, so what he is going to do? He is going to initially from 0 to 45 degrees, he is able to do, he will feel no discomfort in making that arm move. But apart from that, when we are going to talk about more than 45 to 90 degrees, what happens? In certain those conditions, what happens? The patient will not able to lift his arm. Why? Just because from 0 to 45 degrees, the muscle which was helping was deltoid. Okay. So after that, from 45 to 90 degrees, what is happening? Your that traumatized tendon is getting nipped between your tuberosity, as well as your coracoacromial arc. Okay. So that is why the pain that you are going to feel whenever the arm is moved from 45 to 90 degrees, it is just because your tendon is getting nipped between the tuberosity as well as coracoacromial arch. Okay. So this is basically what we are going to look in the clinical features. One more very important thing, whenever you are going to evaluate or assess certain condition like rotator cuff, it is always wrongly diagnosed. Why? Because the adhesive capsulitis symptoms also reveals the same. Okay, the sharp shooting pain is felt here also in the deltoid insertion, and there also it is felt the same. So, but there is one thing that differentiates the two of rotator cuff as well as the adhesive capsulitis, that is, you are going to look that whenever you are attempting to do a certain activity, the pain always exists. But whenever you're going to make yourself deprive of that activity, in case of adhesive capsulitis, the pain stops. But in case of rotator cuff injury, the pain doesn't stop. Its intensity always gets increased with each passing day. And if you have left it neglected, the stiffness and the muscular weakness will persist for longer durations. So whenever you have come across such situation, it is always that you go and seek medical advice for further evaluation and for a perfect diagnosis. Rest, now there is a certain thing like I have told, abduction as well as flexion is impaired. Not only those, external rotation is also impaired in such conditions. So if we are going to talk about now, just like we are going to talk about treatment, okay, let's come to treatment. So what is treatment? What are you going to do? So for acute cases which have got fresh injured, ruptured tendon, for those you are going to suggest a surgical repair, okay? But those conditions in which the condition is very chronic, in that you can always go for conservative treatment as well as you can always go for surgical treatments. So surgical treatment is basically done through anterior acromioplasty, as we all know. And if we are talking about conservative treatment comprises of rest, elevation, icing, compression. Okay, this is very natural, and we all know what is rice. Okay, what is rice we all know. So now we have evaluated and assessed that thing is not, we have thought just like adhesive capsulitis, it is rotator cuff injury. Further you can do one thing, you can always go for CT scans and MRI. Okay, so radiographic evaluation is also very necessary to rule out the situations. Okay, now see, we have already talked what is RICE, conservative treatment means. So rest, you can also go for icing, you can also go for hot modalities. So as per looking through that condition, its severity as well as the extent of injury, you can always go for cryotherapy or hot modalities. Okay. Now we have already talked all this. Now what are the precautions that one should take? So precautions are, first of all, you should always avoid those lifting heavy weights. You should always avoid those weights whose tensile strength is more than your strength of your muscle. So you should avoid those. Okay. Further, what you can do, you should avoid those positions which you feel can in turn may lead into more stretching or will further damage your structure. So those positions, for example, you should avoid abduction as well as flexion initially. I'm not talking about how the procedure of this protocol is going on, but initially you should avoid. Okay. Now next what you can do is, one should always look for the age factor. If the age is the primary cause of concern, one should never go and do such activities which can further damage your tendon itself. Okay, so this thing you need to avoid. Rest, what you can do? Rest, you need to change your position. You have to rebuild your activities of daily living. So all these, if you have got a good therapist, will see and refer to your problems and will look for what you need to get this self-corrected. So you need to have a good therapist to identify your problem. After identifying, to be maintained into a such so that you can have a well-versed diagnosed, as well as after that a good protocol should come out from that. So we have seen कि आपको activities of daily living you have to improve, you have to change your positions, you have to not stand. What happens when you stand, the arm is beside your shoulders. So what happened? It's a very natural thing. The gravity is always that it is assisting this arm downwards. Okay. So a gravitational force is acting on your shoulder. So it is who you have to guide the patient that one should never stand bare arm, okay, beside your shoulder joint. So you can always tell patient initially to maintain your shoulder joint into a sling or sort of a brace. Okay. Then after that the thing remains the same. We were talking about restoration. So first of all, in restoration, what is basic? Like you have to preserve the things. Now for preserving what? You have to preserve the movements which were impaired, as well as the movements which were patient is not able to initiate. So you have to improve those. So the two things which you need to work on, one is the movement, the loss of movement, you have to cover that movement, and the second one is you need to improve pain, and last you need to progress on for strengthening. So this should be your goal. So for movements you can again, for movements and restoration of pain, what you can do is you can always go for isometric contraction. So pain-free isometric contraction, not only the joint which is affected but the joints which are free from pain, you can always go and do that. Next, what you can see, you can always go and look for passive relaxed movements. So passive relaxed movements are those movements which a patient needs to perform with the help of a therapist. Okay, so therapist helps and aids you to perform that. So initially when you have certain trauma in your shoulder, so it is the responsibility of a therapist to look for that, okay, and to make you how to do such patterns. Okay, so position is very important. So what therapist will do? Therapist eventually, for the abduction, what he is going to do, he will make you lie down supine, okay, and he is going to hold your wrist neutral in a neutral position and will stabilize your glenohumeral joint with the second hand, and he will make you to abduct your arm, and as soon as you are able to do that, what will happen? Eventually when you are not using your shoulder girdle muscles, So what is the thing he will progress to? He will progress to progressive resisted exercises. So progressive resisted exercises is the last which you need to cover. Okay. So then if patient is not using his shoulder girdles, and if he is able to do that on its own, then you are going to progress to the third step, that is strengthening. You are going to strengthen its rotators, that is the all three muscle in all three directions, that is abduction, flexion and external and internal rotation. You are going to strengthen all these 3 and 4 group of muscles together. Now after that, what is the next step? Strengthening you have done, everything you have sorted. So for further strengthening, you should not always look for shoulder joint muscle, for example rotator cuff muscle, but also you need to look for the scapular muscles which are behind it and which are aiding it to develop a better and well versed shoulder joint. So you have to always keep in mind, whenever you go for strengthening program, not only the joint which is affected, but apart from that, your scapular muscles, that are also a very important and play a very major role in its shoulder joint to make its ability well versed. So one has to always keep in mind. So I hope you have understood whatever I have taught for today itself, and I shall see you soon. Thank you so very much. Thanks a lot.